Hi, this is Sanda Pinkerton, and I would like to share some information about post-op protocol. OMT treatment goals, there are actually two main aspects. One has to do with wound healing, and the other one has to do with tongue mobility, maximizing range of motion, and observing and promoting the habituation of proper oral rest posture. In terms of wound healing, there are 5 phases, and we always like to advise for the first 3 days the patient just to take care of the wound healing. And in terms of tongue mobility, advising them just to do light stretches, talking a lot, eating ice cream, and really light clicks if that's possible and if they are not in pain. And on the third day, we always like to have a Zoom session with them. And the reason is because we want to evaluate the wound healing. And what I'm looking here, it is at the inflammation level, pain level, and the amount of granulation tissue, if any. On the other hand, I like to evaluate the tongue mobility and then to go over again about compensatory muscle function, to talk about the cheek, lip, and tongue coordination, and also reviewing wound healing physiology. After a week, at 1 week mark, we always start the exercise routine. When healing, this graphic here, I always like to share with my patient about 2 appointments before the surgery. And I always explain to them that there is, first of all, is bleeding. That in the beginning, and it might be a little bit of oozing in the beginning and the first day, and that is totally normal. Then there is redness, and then that's called inflammation. It might build up a little bit of granulation tissue, which looks like white tissue, and they need to understand that inflammation and granulation, those are phases which they can overlap. And the first 10 days, although you have inflammation and granulation tissue present, they feel like they have a wonderful mobility. They are absolutely happy, those patients. Now, by around 10 days, the wound contraction starts. And that is the time when the patient needs the most support from us as therapists, because everything starts to contract. And that's what I always like to explain those phases, because they need to know the wound will be contracting. They will feel like they need to run against the wind in order to perform those exercises. But then between the week 8 to 10, the tissues start to soften up, and then everything starts to be back to normal and feeling good. So now let's go a little bit over the physiological stage of wound healing. Obviously, we have the hemostasis or bleeding at the time of the surgery. And like I already mentioned, it could be a little bit of wheezing, which is considered normal the first day. Right after the surgery, we advise the patient to keep rinsing and then to talk and to move the tongue lightly. And if they can, only if they can, if there is no pain present, to do light clicks. Then we go over the inflammation/proliferation, and those phases, they overlap. Like you can see in this picture, there is still a little bit of redness, and then also it is a little bit of granulation tissue. In this case, it's not too much. However, you might have patients building a lot of granulation tissue, and those patients will be the ones you need to explain, listen, then we need to have a white film there, but if it starts to build a lot more, we need to take care of that. So we'll continue to rinse, and then we need to use the surgical brush very gently, going over the wound, paying attention not to remove the stitches. Proliferation is the phase where patients start to get discouraged because, oh my God, what happened? My tongue is stuck, it's hard to move. And that's the phase where we need to support them the most. We need to remind them to remember this is the phase when the wound is contracting, and that is normal. That's how everything is healing. And we just need to work really hard to make sure we execute those exercises in a daily basis and not to give up. And sometimes feels like you run against the wind, but you need to be perseverant. At that point, we start teaching them how to perform the exercises. We need to remind again about the compensatory movement. Meaning we need to swallow, lifting the tongue. We don't want to protrude our jaw. We don't want to lift and to involve the floor of the mouth in the swallowing process. Maturation, it can happen anywhere between the 8 to 10 weeks after the surgery. And that is a time when they feel like the tissue becomes again soft and they can perform the exercises with a lot more ease. Sometimes the range of motion, it might not be as great as it was right after the surgery, but that is still considered normal if they can function and if they can perform the swallowing and the talking in normal, what it's considered normal range. Post-op manual stretches are a segment that we introduce in parallel with exercises right after the surgery. The first 3 days, we don't advise stretches. We do start stretches right after the 3rd day when the patient already understands and knows how to perform them. First of all, we have what we call a whole tongue body and pulling out to the point of a slight strain and hold it in that posture, frontal and both sides, until the pain dissipates. The other massage stretch, it is massaging the floor of the mouth and also moving the fingers under the tongue, body of the tongue. And the third, it is what we call the forklift, raising using the 2 fingers, the 2 index fingers, to raise the tongue vertically. Post-op exercises focus, it is to use exercises the patients are used, but then incrementally increase in intensity in accordance with the patient progress. The most important factor it is to have a thorough reevaluation about the 10th session to see where the patient still needs help. And mostly it happens to be for swallowing, and it's about compensation present or not, about tongue mobility and condition of the tongue tone. Thank you very much for all of you being here and keeping a curious mind and the desire to expand your knowledge to better the care you provide to your patients. Thank you again.